cardiorenal metabolic diseases already represent a worldwide health crisis. 1 billion people are living with these diseases worldwide, with one or more of these conditions. We have 800 million people worldwide living just with kidney damage. Colleagues who had already worked here in the country, who knew the country, they told me, as a medical director there, this is a paradise. There is no other country in the world that has so strong registries around patients and about health data. But we also need to leverage these registries.
Across the world, more people are living with several chronic diseases at the same time. Conditions like heart disease, kidney problems, and diabetes are closely linked. Yet most health systems still treat them as if they were separate. Now, a growing number of countries are rethinking how to organize care by integrating treatment and prevention across traditional boundaries. So how can those lessons inspire change here in Denmark? And what will it take to make policies and reforms deliver real results for patients? That's what we are exploring in today's episode. Welcome to Business Review Life Science, the podcast where we focus on innovation, challenges, and the future of health. The topic today is policy in action, global lessons, and local opportunities. I'm your host, Heidi Nielsen. My guest today is Medical Director at Boehringer Ingelheim in Denmark, Dorrit Casati. So, Dorrit, what lessons can we learn from countries that have successfully integrated care for cardiovascular, renal, and metabolic diseases?
I think Denmark can learn a lot from other countries, but also other countries can learn a lot from Denmark. And Denmark is actually in a very good place when it comes to scientific advancements and healthcare around our patients. But always good to have a look on what others are doing, because you can find in many countries certain initiatives, and when you put them together, it can result into a bigger picture, into a nicer picture for patients living with cardiorenal metabolic conditions. So, for example, we see in the US efforts to introduce a new specialty, the cardiorenal metabolic specialty around physicians. Nowadays, a physician can specialize around heart diseases, can specialize around metabolic diseases, can specialize around kidney diseases. But there has been so far no specialization around all three of them. And this could be also a great example for Denmark and also for other countries to have this specialty in place, because it would make this physicians also owners of this interconnected, complex conditions. And this, a physician taking care of CRM condition can also better help the general practitioner, the family doctor, to do more in terms of prevention and early detection. Other examples, positive examples that we see, for example, in England, are the creation of clinics that deal also with interconnected conditions. We see in London, for example, a new cardiometabolic clinic. In Liverpool, there is a new cardiorenal clinic. And I believe also in Denmark, there are efforts to create this type of clinics within hospitals. We also need to look more into family doctor and offices, networks in the country. Where do we have the opportunity to bring these three specialties together and to create this unified approach for people living with these conditions or at risk of developing these conditions.
So do you see some barriers to implement these things in Denmark that you just mentioned?
There are always a lot of barriers to move from strategy to action. But I would say, in the first place, it's great to have a strategy. And I was also very happy to see that in Denmark, since 2021, there is a very ambitious vision put into a formal strategy called the National Life Science Strategy, of the country published by the government, which has this very bold vision that Denmark must become one of the leading nations in Europe when it comes to life sciences, for the benefit of our patients, for the benefit of our healthcare system, for the benefit of our economy. And this is a very bold vision. Now, when we look into the steps to make this vision a reality, I believe the healthcare reform is a big opportunity to do this and to translate this into action. And I think the work around this has just started.
But yeah, as you mentioned, Denmark is known for having a strong healthcare system. So why is it so important to look abroad for inspiration?
Well, there are always these small pieces of inspiration. I would not just say inspiration, but also best practices that you can implement here in the country. We just mentioned a few examples from the world. There are also other countries like Italy, for example, who has already introduced something similar to a care package. They called it a health program around cardiometabolic diseases. So we see here also the first efforts to combine things that belong together. And this is very important for Denmark, and is also it can be also efficiently implemented in a country like Denmark, where you already have a strong healthcare system in place, where you already have a high level of data sharing in place, where you already have very strong registries in place. Before coming here to work in Denmark, colleagues who had already worked here in the country, who knew the country, they told me, as a medical director there, this is a paradise. There is no other country in the world that has so strong registries and so broad registries around patients and about health data. But we also need to leverage these registries. And they are being already leveraged, but it needs to be done more. It needs to be done more frequently for the benefit of our patients. There is a lot of data from which we can learn in these registries.
So they don't do that in other countries?
So in other countries, they need sometimes to start, not from scratch, but to start building this registry. So having a registry in place is already a positive development in Denmark, and can be a positive development in other countries. As said, there is also so much that other countries can learn from Denmark.
You're listening to Business Review Life Science, the podcast where we focus on innovation, challenges, and the future of health. The topic today is policy in action, global lessons, and local opportunities. I'm your host, Heidi Nielsen. My guest today is Medical Director at Boehringer Ingelheim in Denmark, Dorette Casati. So let's talk about the global focus on cardiovascular health. Why do supranational bodies like World Health Organization and EU focus on cardiovascular health, do you think?
It has already been recognized that cardiorenal metabolic diseases already represent a worldwide health crisis. 1 billion people are living with these diseases worldwide, with one or more of these conditions. We have 800 million people worldwide living just with kidney damage. And just if you look into only the heart or cardiovascular diseases are nowadays the number one killer worldwide, leading to 20 million deaths. And this represents already 30% of all deaths that occur worldwide, more than accidents, more than cancer. If you look into isolated kidney disease itself, is already also number 9 in terms of reasons for deaths worldwide. And the issue with those deaths is also that 1/3 of them is what we call premature deaths that occur in an age younger than 70. And this is why it has been recognized as a health crisis, and this is why also the World Health Organization have created their sustainable development goals, and one of them being number 3.4, saying that by the year 2030, we want to reduce the number of premature deaths coming from non-communicable diseases by 1/3, which is a very ambitious goal. And this is why this was a push also for countries worldwide to start putting programs in place to deal with these interconnected conditions. Everything starts by recognizing the interconnectivity of these diseases. And in the past, we didn't have so much awareness how one condition can lead to the others. And it is interesting how sometimes things can evolve or things can develop from sometimes positive other things that happen, sometimes also negative happenings in the world. I remember that 20 years ago, almost 20 years ago, where we had also diabetes medication in place, there were trials demonstrating that the one or the other of these therapies can cause heart damage, which was a surprising finding at that time, but which led to the world overall, to the scientific community, being more careful about the introduction of new medications. So much larger trial programs were put in place to look after diabetes medication. Through these trial programs, through this extensive research that was done, now we are able to have medication in place that not only do not damage the heart, but now offer also a broader organ protection, and do not only treat diabetes, but also the heart and the kidneys at the same time. So it's interesting sometimes to see how some, say, negative happening can lead to a very positive development, but it needs a lot of time, it needs a lot of research, and that's why we are all here, right?
Yeah. So how do we move from resolution and plans to policy change and tangible benefits for patients?
I think what we mentioned before is that everything starts by having a strong strategy in place and by having an ambitious vision in place. And it's great that Denmark has this already in place with its life science strategy. And it's also great to see this bold ambition to be one of the leading life science nations in Europe. It's not just a bold ambition. It's not just a goal. We just want to be a number one or to be a leading country. But it is a goal because we all understand, and the government understands, the society understands, that if you are a leading nation in the life cycle, this benefits your patients, this benefits the healthcare system as such, and this benefits also the economy of the country. So it all starts with a strategy. Now, how to translate this into action, right? This is the big question. The healthcare reform that has been presented and is in the doing, this is now a great opportunity to bring care more near to the patients in the country. And I see here multiple opportunities. Number one is the reduction in administration. And I think this has been also the reason why the government wants to reduce the number of regions from 5 to 4 in the country, and which we hope that will make the ways for the patient a bit shorter and will make the patient journeys a bit easier for them. So this is already a great step forward. Now, another great plan of the government is to shift resources from the larger cities more to the remote areas. I think this is a great step to reduce the inequality in healthcare. And it's not just about shifting the resources. From what I know, and I hope this will be the case, it's also about increasing the number of family doctors in the country overall. And why is this super crucial? It is crucial because so far the tasks and the expectation towards family doctors have been very, very high. When we talk about cardiorenal metabolic conditions, who is the one that plays the major roles in terms of detection of those diseases, in terms of prevention, and in terms of a holistic treatment of those diseases? It is the family doctor, who at the same time is very overloaded with hundreds and hundreds of other diseases they need to take care. So in increasing, or by increasing the number of physicians, this is already a great step towards giving them more opportunity, hopefully a bit more time to deal also with this very, very complex cluster of diseases. But it's not just done by increasing the number of physicians. We need also a mindset shift. And this is very important. The mindset shift starts at the policy level. Today, the family doctor might be seen more as a gatekeeper, sometimes as a protector of the healthcare budget from the patient who might want to make more use of it than they should. But this needs to shift. The family doctor should be seen not as just the gatekeeper. He should be seen as the promoter of health. He should be seen as a promoter of early screening, as a promoter of prevention, instead of just treating diseases. And I think this is something that will need some time, but this is also the reason we are talking about.
So how can the policy makers create this mind shift?
I think the healthcare reform is hopefully will play already a role in this with the steps that we just mentioned: reduction of administration, increase of the number of physicians. But what might be still missing, and what we might need still, is to introduce an incentive system for family doctors, for the doctors and for the healthcare system, to reward a physician for achieving success in the prevention of diseases or in the treatment of diseases. Right now, for example, we see that I think during the first podcast we had the opportunity to talk about the importance of kidney tests. And yes, you will hear me also a lot talking about kidney. I mean, we are talking about cardiorenal metabolic diseases, but the focus on kidney disease is high because this is where the awareness is lower. So we spoke about the importance of this test. And we need a push to talk about the importance of a certain test in the diagnosis of kidney disease. And for this, a more proactive approach is needed. How do you get this proactive approach? How about also using advances in technology that we have seen? Advances in artificial intelligence, advances in digital tools. As mentioned before, Denmark is already in a great place to have all data around our patients being registered, being stored digitally. They are accessible. Now let's make use out of them. How to make use out of them? For example, you could run a program around your own database in your office who can proactively tell you which one are the patients at risk or most at risk to develop, let's say, kidney disease or to develop heart disease. And those patients could proactively be called in the office to perform the one or the other diagnostic test, or maybe even to receive a therapy that now is able to cover and to offer a broader organ protection than it was before. But in order to do this, again, there needs to be also support from the policy maker. They need to proactively shift the role of the family doctor from a doctor who is a gatekeeper of the healthcare system, which she can continue to be, but more towards somebody who is responsible for prevention of diseases and also for proper treatment of diseases.
You're listening to Business Review Life Science, the podcast where we focus on innovation, challenges, and the future of health. The topic today is policy in action, global lessons, and local opportunities. I'm your host, Heidi Nielsen. My guest today is Medical Director at Boehringer Ingelheim in Denmark, Dorrit Castrati. Let's talk about what we already do when we're treating these diseases. Could you maybe elaborate on what are the most effective strategies for early detection and prevention of kidney and heart diseases?
The most effective strategy is the proper screening. First, this is step number one. And we spoke a bit about how we could leverage also tools, digital tools and databases, strong databases that we have to perform a proper screening. So to identify those groups of patients that are at a higher risk to develop a certain condition like kidney disease. And we know nowadays, exactly because science has evolved, that, for example, diabetes is a very important risk factor to develop kidney disease. High blood pressure is a very important risk factor in developing kidney disease. These patients can nowadays be easily identified with this. They can be called proactively in the office, or when they are there, it's very, very important that we perform then, and this is the second step, that the right tests, diagnostic tests, are being performed. And in this area, we are not talking about complicated tests. We had the opportunity already to talk a bit about the tests, the diagnostic tests that a physician should perform to test the kidney function. The EGFR test, the blood test, which is already being done routinely in the doctor's practice, fortunately, which will show how well or not well kidneys are doing their job, filtering waste from our bodies. And then there is this other test, the UACR test, which gives you the opportunity to detect kidney damage even earlier. And this is the one test that is not being performed as frequently as it maybe should. And this is why we are calling so much and we are talking so much about the simple test, which is done via a urine sample, easy to collect, and which also not too expensive. So this is, I believe, very important step number 2. Step number 3 is that when treating one of these conditions, we use medications that can cover or can offer also a broader organ protection, because also medicine or medications have evolved in the last years. And we have now a much broader portfolio of drugs that we can choose from. So it is very, very important that this knowledge at the physician's level evolves, but this knowledge also at the payer level, at the health policy maker level also evolves, that they know that this is now available and can be used for the benefit of the patient and at the end also for the benefit of the whole healthcare system.
So how can we share knowledge?
Through partnerships, through strong partnerships. And this is why we are here in the first place as a pharma company. Also to share the knowledge that we win through the research that we perform. And we are already doing a lot in this direction in terms of educational activities. And when it comes to partnerships, I think there are 3 important pillars of partnerships. Number 1 are partnerships with physicians and with medical societies. I think here we are in a very good place. We're collaborating a lot with them. We share the same knowledge. We help each other with knowledge, with new knowledge that arises from the science we are performing. And we help each other where to put the right focus right now. The second very important partnership is with policy makers. And this is something I believe that where we could improve from both sides. Why is this important? Because we can help each other to understand where the focus right now could live. Policymakers have their holistic view around healthcare budgets, around the whole healthcare situations in Denmark. We might have a more narrow view, but we as a pharma industry might know even a bit better which one disease can be the lever to change more effectively things around other diseases. Like we were talking now together around the cluster of cardiorenal metabolic diseases and how kidney disease can be is a very important factor in making things better for patients living with all conditions or at risk of developing these conditions. And the third pillar, which might be overlooked sometimes, are partnerships with patient organizations. Patient organizations are becoming more and more important because the patient voice is becoming more and more stronger in terms of treatment and in terms of prevention. And here there are a lot of activities that we do together with patient organizations, and surely more can be done. But I want to mention one example that was made visible in the country through the partnership with and through the collaboration with a patient organization. There is a patient, a real patient, here in Denmark. Her name is Edda. And she was so kind to share her story with the patient organization and also with us, because she has been living with kidney disease for 30 years, but she didn't know about it. She is an example. I wouldn't say a great example, but she is an unfortunate example on how sometimes patient journeys can be and how they should not be. Her story started 30 years ago when she started to have some issues with her health, and she started to visit her family doctor. But as we spoke before, family doctors having a lot of diseases they need to take care of, being overloaded with a lot of topics, a lot of administration they need to take care of. They didn't have the focus that was needed on the disease, on Edda's issues. And then when they started to do something, then I had mentioned, I think in the first podcast, this paradoxical situation that we have. Once you break through the system, then it can become also too complex, where you need to see different doctors and they all take care of a certain aspect of your health, of a certain organ, but never, unfortunately, of the overall picture. And this is how her story went on until she reached a phase where her disease, her kidney disease, was so progressed that there was no other ways other than the dialysis, and then later kidney transplant. And now she's living with a new kidney, which is great, but there are also other patients that do not have a chance to get a new organ. And I believe we also don't want to be in such a situation where you need to replace your organ. So I think Edda's story is a very impressive example, and it's an example that should make us all awake, I would say, and to push us to do more in this direction, to raise awareness, to increase, to strengthen these partnerships that we have with the different healthcare stakeholders, and to do more for patients living with this CRM conditions.
You're listening to Business Review Life Science, the podcast where we focus on innovation, challenges, and the future of health. The topic today is policy in action, global lessons, and local opportunities. I'm your host, Heidi Nielsen. My guest today is Medical Director at Boehringer Ingelheim, Denmark, Dorette Castrati. So let's talk a bit about the future. What kind of reforms and political shifts do we need if we want to truly integrate care for heart, kidney, and metabolic diseases?
So the most important thing here, or the biggest opportunity that we have here now, is the introduction of the chronic care packages. And this is why this is also probably the most important topic also in this discussion that we are having now, because now it is really the time to action upon the urgency that we see here. Whereas it's a great development that the government is planning to introduce packages around chronic diseases, and it's also great to see the plans, the concrete plans that we have now in place to introduce a diabetes healthcare package. It's also the time to discuss, and not just to discuss, but also maybe also to decide together to introduce from the beginning a more holistic care package, a care package that covers not just diabetes, but covers diabetes, heart disease, and kidney disease. For now, the plan is to do this step by step again. And we are appealing to the government to introduce from the beginning a more holistic, a more unified CRM care package. It is a complex undertaking, that's clear. But I believe that our knowledge now has also evolved to a stage where we can make this happen. In this direction, there are already positive steps that we see. We spoke about the reduction of administration. We spoke about the increase in the number of physicians, family doctors in the country, also the shift of resources to more remote areas to reduce health inequality. And I believe this is a very important factor because we know nowadays how important socioeconomic factors are in the risk to develop health conditions. And we see that certain patients, maybe that live in, say, a bit of in a more remote area, they might have also a higher risk to develop a certain condition because they might not be able to see a doctor as frequently as somebody that lives in a larger city where you have so many physicians around. So this is a great development that we see here. But what is also super important is the mindset shift towards empowering the family doctor, giving him or her the opportunity to take a larger role in the prevention of the diseases instead of just treating the symptoms. And this is where policymakers can do more.
You're listening to Business Review Life Science, the podcast where we focus on innovation, challenges, and the future of health. The topic today was Policy in Action, Global Lessons and Local Opportunities. I'm your host, Heidi Nielsen. Our guest today was Dorette Castrati, Medical Director at Boehringer Ingelheim in Denmark. Thank you for joining me, and thanks to all of you for listening.
Thank you for having me, Heidi.